Hey there, sports psych enthusiasts. I'm Dr. Colin Fehr, and I want to share my passion with you. I love talking about ways to unleash the power of the mind. This recording is part of a larger lecture series I've created in an effort to make sports psychology concepts more accessible to a larger audience. The information contained in this series is especially well suited for students of sports psychology and is presented in a way that makes for easy listening for all. Welcome to Sports Psych Concepts.
Hey there, everyone. Welcome to the latest rendition of Sport Psych Concepts. Today, I want to talk about something that is really an important set of skills, essentially. And those are, of course, the basic consulting skills that we have to use. A lot of discussion in the sports psychology space is on mental skills that we develop within the athletes or performers that we're working with, and we design these interventions and put together these great programs for them. But there's some skills that precede that we need to possess as practitioners to make sure we can even get our clients to trust us enough to where we can come up with those other skills, or even accurately or appropriately use assessments and in terms of a needs assessment, and then designing those programs. So there's so much that could be included in this presentation, so just please know I'm not intending for this to be exhaustive. I'm just going to cover some of the key areas, things like active listening, other effective communication components, staying ethical, looking at that, like ethical reasoning as a consulting skill that we need to have. And that's kind of the basis that I'm operating from. But just know that there's more that could be said about this. But with that, let's jump into what I've got prepared for you. Now, before we dive into some of the specific skills that I'm going to talk about, I think it's important to understand that the relationship itself between the client, the athlete, the performer, and the practitioner, that sits at the foundation of everything that we do. And so if you think about relationships, think about what makes a great relationship in general. There's some universality there, some common principles that we can look at, and we want our performers, our clients, to feel like that relationship is strong and that we care about them, and that it's governed by respect, because those sorts of things are consistently linked to positive outcomes, regardless of anything that we do, any sort of intervention or treatment plan that we come up with. A strong relationship at the foundation, at the core of what we do, is linked with positive outcomes by itself. Those of you who are familiar with the clinical space, to talk about some of these different therapeutic factors and things that contribute, and interventions are one thing, and then there's things that the clients bring with them themselves that can help them achieve whatever their goals are. And then just the relationship, providing a very specific kind of relationship that's professional and characterized in the ways that I described it, that by itself can be a vehicle for change. So understanding that and recognizing that at the beginning is important. So I mean, essentially, just think about, we need to approach our clients with a mindset that they are the experts in their own lives and their professions and what they're doing. So our role is not to dictate to them what they need to do, but to collaborate with them, to work with them, to create that safe and trusting alliance that really is what allows us to help them achieve their goals. Okay, so think of it this way: relationships are the cornerstone of success. The quality of the professional relationship that we establish with our clients is going to underpin all of those positive outcomes. Okay, so we keep all of this in mind and use that collaborative approach that's built on mutual care and respect, and everything else follows that. So that's what we start with, is those relationship building skills to establish this. So with the relationship at the core, let's now discuss some of the key skills that will help establish that relationship and build that trust and rapport that we need for everything else. And the first thing I want to mention is really one of the most fundamental sets of skills, and that's attending behavior and listening. Now, of course, this is one of those things that sounds simple, right? Effective listening. Oh, okay. That's we're familiar with that. Everybody knows we need to do that, but it requires some coordinated actions and skills collectively. Now, attending behavior, if to describe this to make sure we're all on the same page, is really about immersing ourselves in the immediacy of the moment, the here and now, giving our clients our full and undivided attention. So it's not just about hearing words, it's about demonstrating that we are there, that we're present, that we are attending to our clients with our body language. So appropriate eye contact, we have an open posture, maybe we're leaning in slightly, we're not leaning away, having our arms folded, that we're closed off to our clients. We're just demonstrating with our attending behavior, right? Those are actions to communicate to our clients that we are fully engaged. Okay. And the like I said, the initial focus of attending behavior and listening is on building rapport. We're not trying to solve any problems. We're just trying to be there and focus on connection. Okay. It's very, very important. And so, as I said, there's just some key critical components that we need to keep in mind with this. But essentially, we're just sitting there with our clients, focusing on what they're saying and what they're feeling. We're not trying to jump to solutions. Now, let's talk a little bit more about active listening. And yes, I describe this as the art of active listening. So this goes beyond just attending, just being there. It's about using specific tools to deepen our understanding of what our clients are communicating to us. So after attending, or well, just continually, because we're going to continue attending. It's not like it's a one-time act, but as we're continuing to demonstrate attending behavior, we will use questions to encourage our clients to tell their stories, or reflections, right? We may paraphrase, summarize what it is that they're saying, but that communicates that we're listening. We're using perception checking. Am I getting this right? It seems like you're saying this. Help me understand this a little bit better. Those sorts of things. Okay, so with this, it's a common mistake that practitioners will make is that we can get sidetracked by unimportant details. Okay, and so by using well-placed, open-ended questions, perception checking, those sorts of things, we can make sure that we're focusing on the important things, because our clients will tell us. They'll say, no, that's not really it. I'm like, okay, good thing that I asked, so I'm not paying attention to the wrong things. And so, like I said, you can use those different skills. We can use paraphrasing to repackage what it is they said, restate their story, hand it back to them to show them that we've understood. And summarizing is another way. It helps us bring together all the different pieces of their story to create this overall sort of cohesive narrative. And just ultimately, we're showing the client that their story has been heard and understood by us. That is what active listening is all about. And so as I said before, we do all of these things in an effort to build trust and rapport. Trust itself, of course, is the bedrock of the client consultant relationship. It's not something that we can just demand because we're in our position and we have our credentials. It's something that we have to earn, and we continually earn that, right? Trust is something that is built continually. It's also not a one-time event. And so the ways that we build trust are by, well, just consistently demonstrating that we're personable. So that human side, we're being real, we're being genuine, authentic, where it's not this contrived interaction between the professional and the client. We show them that we're good communicators and that we're trustworthy, right? We have integrity. We do the things that we say that we're gonna do. If we take our client through our informed consent process and we say this is going to be our primary approach, but then we do something completely different, that's not setting ourselves up to be demonstrate trustworthiness to our clients. Okay, so another part of this is maintaining clear professional boundaries. So we should definitely be friendly, approachable, personable, but we are not our clients' friends. It's very important to understand that. And it's a specific kind of relationship, and it's something that practitioners run into quite often, where a client will start to wonder about their consultant. Like, yeah, they know a whole lot about me, but I don't really know that much about them. And so they might get curious and they might want to ask. And so there's definitely things that we can explore with that. But the main message I want to share here is that's not the point. It's a different kind of relationship. It's not one where there is a mutual level of breadth and depth of sharing on in terms of personal content of each other's lives. That's not what it is. And so we can be friendly and approachable, but we are not their friends. It's a different kind of thing. Okay, and then the last thing that I'll mention regarding trust and rapport is just we need to be both flexible and accessible in our approach. When we do this, it shows our commitment to our client and helps to solidify the trusting relationship that we've established. Just to loop this all the way back to what I mentioned at the beginning, that the relationship is at the core of everything we do. Now let's move on to we'll call it a more advanced communication skill, okay, or skill set, and that is challenging and confronting our clients on things that they're saying or inconsistencies in the story or the narrative or between what they're saying and their behavior, their actions, those sorts of things is what I'm talking about here. Now, I should say that when I say challenge your client or confront your client, it can sound aggressive and hostile, but in a consulting context, it's quite the opposite. Okay, especially if we take this, I think and I want to say this in an intentional way, but if we view our clients with compassion, you could even you could attach the word love to this. Love is a strong word, and so just know I recognize that when I say that. I'm just saying in terms of like a compassionate love toward human beings, humanity, and other people, and so we can exude that toward our clients. So we have this compassionate sort of love toward them as fellow humans on a journey together. When we look at challenging and confronting in that context, it is quite the opposite. It's not aggressive, it's not hostile. We're genuinely trying to help them. So the goal when we do this is to challenge our clients, but in a compassionate way. And we're highlighting key issues to help them move forward. So again, as I said before, we don't want to get sidetracked by unimportant details and challenge them on those things. It's like, what is a critical thing? What's the core issue here? Let's focus on that and do it in a compassionate way. Okay, so to build on this, instead of focusing on past experiences, we'll try to keep the issue in the present where it can be addressed directly. This is just like great relationship advice in general, right? People will be with a partner and they'll be upset about something, and so then they start throwing the kitchen sink, everything in the past that's ever been wrong, and how the dishwasher was loaded or whatever, these different issues, and we start to throw that stuff. And so we're focusing on, okay, keep the issue in the present where we can directly work on it right here. Okay, now this isn't, when we challenge or confront our clients, I shouldn't say, like, even when we do it compassionately, there is some risk involved with it. And so we don't want to do this too soon. It has to be built on a solid foundation of trust and rapport with our clients. So there has to be a relationship first. We build the trust and the rapport first, and this could be over the course of multiple sessions even before we really get to that point to where we're calling them out. Is how I frame it informally. Is like sometimes we have to call them out on what it is that they're saying that doesn't align. But even still, we have that foundation. We built the trusting relationship. They're starting to open up more. They're disclosing more. And then we going to go in with a challenge on something that they say. After we initiate the challenge, we confront them on the thing. We go right back to rapport building and connection to show them that, hey, I'm still here with you. I'm not being adversarial and trying to push back on you just to push back on you. It's because I actually want to try and help you. So that intent, communicating that intent and going back to building rapport is a key way to doing this successfully. All right, so I want to build on this idea a little bit further of compassionate confrontation. So a key aspect of this is to do it effectively is understanding where the client is in their journey. So there's different models or frameworks that you could use here. So I'll just mention one and you can dig a little deeper on this, but the trans theoretical model of behavior change might be a useful framework for us to explore this. So that if you're not familiar with that, you have these different stages of change where initially the client might be in a pre-contemplation stage. Usually they're going to be past that if they're with us, not always, but you have pre-contemplation when they're not really thinking about changing, and then they move to contemplation where they're like, okay, well maybe I might change, and then they move to the planning stage where they're actively thinking about it, and then they move to the action stage where they are doing it, and then the maintenance stage at the end, and sometimes there's a termination stage on there. Okay, but it's just a stage framework. So whatever the framework is, we just need to know where they're at on that, so then we can match our approach to their stage of readiness. So for example, if a client is in denial about an issue, okay, where we maybe will say that they're in, this would be pre-contemplation. Okay, they're in that early stage. So a gentle challenge there from us might involve just raising their awareness through education. They just may not know. And so our goal is not to just be, oh, well, you need to change this and all that. We're just trying to raise their awareness, provide some education on some different things. Okay, but it's about meeting our clients where they are and then using their frame of reference. So we need to know where they are in terms of the approach that we're using, the framework, the model, and then align that with their frame of reference to help them achieve their goals. So hopefully all of that makes sense, because there's other models that you could use um, for this, but whatever it is, we want to make sure we're matching that up with their readiness. Now, another skill, this is kind of shifting gears a little bit, but another one I want to mention that is important for us as practitioners is our own self-awareness, because our effectiveness as consultants isn't just about the techniques that we use, it's about who we are as people. There's certain innate qualities. It's the human thing. This is one of those things that I mention sometimes is I've heard that, artificial intelligence is going to take over helping professions, and there's not going to be a need anymore to go and see a consultant or a counselor or a therapist, anyone in those roles. I think that may be a little bit far-fetched, because the person side of it, the people side of it, the human side of it is what makes it unique. And this is something that we can uniquely offer to our clients, is who we are as a person, a genuine, authentic practitioner. And it's a powerful tool on its own. Okay, so this is like the relationship, this is foundational for our practice, but we have to have a level of self-awareness, or we should strive for this process known as individuation, which essentially is just the alignment of our personal values and beliefs with our professional identity. So we don't want there to be some conflict there where we have basically perpetual imposter syndrome, where I feel like I've got this cognitive dissonance because my values and what it is that's important to me on a personal level doesn't really line up with what I'm doing professionally and my professional identity. So we want to have individuation there. We want to achieve that. And part of this includes being aware of our own personality traits, some of our own biases and how we see the world and look at things, and just understanding how those things might affect our interactions with clients. So this I'm presenting to you as a sort of separate skill set. We could look at it as a process of self-awareness, but it's one of those things that's continual. We want to know how clients experience us as individuals. We don't want to be in the dark on those things. We need to understand that, and so part of that is better understanding ourselves. So we can seek supervision, we can seek feedback from our clients, we can record our sessions and watch ourselves do a consultation. That can be really a powerful tool. There's many ways, but we're trying to stay humble and curious so we continually engage with this process. Okay, so I mentioned at the beginning that I wanted to mention ethics as part of this. And, ethics is one of those things that you can take an entire class on this. You could talk about it. This is definitely a process. It's ongoing that we're continuing to work at. But I'm presenting it here again as we're talking about consulting skills, and this is what we want to use our skills ethically, and so that becomes like this overarching skill in itself. And we have ethics codes that are there. The Association for Applied Sports Psychology, the APA has codes. If you're a member of the American Counseling Association, there's codes there. So different organizations have put these out, and there's different position stands and things. But the idea here that I want to share is that the ethics codes are not just these aspirational things, but they actually can have, they're actually enforceable standards that govern our professional conduct. If we're members of those organizations, there can be disciplinary consequences if we're not adhering to those things. So there's, the serious side of things, but it just ensures that we're operating with integrity and that we're protecting our clients. Now, there's a lot of different ethical issues that are included in there, but I'm just going to talk about competence here because we're talking about skills, right? And so we need to make sure that we're qualified to provide the services that we offer to our clients, and because we want to do good and avoid harm, right? There's beneficence and non-maleficence if you're looking for the specific terms there. But so we have boundaries of competence, then we have clear just professional boundaries of the things that we're going to talk about. So we're not engaging in dual relationships, we're maintaining confidentiality, all of these things. And so, like I said, I'm not going to go into tons of detail on those. I just wanted to mention them because everything that we're doing, the skills that we are demonstrating as part of our practice, it's tied in ethics. Ethics are at the core, and it's not just this one-time consideration. Now I've arrived, I'm competent, I'm there. It requires this continuous and oftentimes nuanced decision making. That's why you can seek ethical consultation from ethics committees if you're faced with different ethical dilemmas. Okay, so I want to expand, now that we have that as the backdrop, on boundaries of competence as a specific thing. Because as I mentioned, we're talking about skills, and you could include physical skills, technical skills, tactical skills, whatever it is. We're talking about consulting skills here, but we have boundaries of for our skill sets. Okay, boundaries of competence, and this is it's a non-negotiable ethical principle. Okay, or just to put it more definitionally, it means that we have both a professional and an ethical obligation to only provide services or execute skills that are within our scope of practice based on, whatever our education was, training that we've gone through, and the credentials. Okay, so it's particularly important for professionals from different backgrounds. So in the sports psychology space, some of us are trained more from the sports science perspective. Some of us are trained more from a clinical psychology or counseling perspective. And so we're coming at things differently. We're going to have different skill sets. And so we don't want to pretend like we can do everything that someone else does that may have more training or more competence in those things. So in other words, we have to be aware of our own limitations. So an important strategy that's a part of this is to have a robust referral network. So if a client comes and presents with an issue that falls outside our expertise or skill set, so the classic example is I'm a certified mental performance consultant who focuses on performance and those types of mental skills with athletes or other performers, and an athlete comes in and they have some clinical issue dealing with depression, maybe bipolar, some different things that have a clinical backdrop to them. The more ethical choice in that instance is to refer them to a more suitable professional. So recognizing those things itself, it's part of the self-awareness thing, and is a skill in its own right. And so with those things in mind, this is really what I've been building toward with the last few things that I've mentioned, and that's just ethical decision making. So this itself, it's a continuous process, and decision making, certainly. I mean, I think about this. I've worked with athletes on how to make better decisions and different processes that they can go through on that, and how that is a skill in itself that can be developed, something that they can demonstrate. And so if we're thinking about this in our role as consultants, a first step, a really important first step, is to be clear about our role as a consultant and to communicate that to our clients. They need to understand what their role is and what our role is and what the expectations are. And we can use if we're trying to determine whether we have the competence or whether we can provide what is necessary based on our skill set to our clients, we can use a screening process. It's part of the intake. It could even be done before that. I actually did one of these recently where I had a conversation with a parent who was interested in me working with their athlete, who was a youth athlete, and I had the conversation before just to make sure it was part of the screening process, to make sure I could provide what it was that seemed like they were needing, and making sure that they're receiving the most appropriate care. Whether that was in this instance, I am going to meet with that athlete, but whether it's from me or it's someone else, the most ethical choice is always to prioritize the client's well-being and the best outcomes to them, which means we have to be ready to adjust our role or refer them to another professional if what they're needing changes or it exceeds our capabilities. So with that, I'll just wrap things up now that you've stayed with me this long to summarize everything that I've talked about. Um, the relationship is at the core. So remember that. It's a key takeaway for you from this is we're starting with that, and we build, and everything is centered around that. That's the cornerstone of our work, because it's going to dictate the success of all of our interventions. So if we want to foster that, we have to master these foundational consulting skills. We begin that journey by simply actively attending and listening, just making sure we're truly hearing what it is our clients are saying, what their stories are. So then we can build on that by using other effective communication tools. And I didn't talk about all of those, but it can be reflecting, paraphrasing, summarizing, all of those different things. But it also can include a very purposeful but compassionate act of challenging our clients to help them grow. We have to be willing to push them on things, even if maybe they don't feel like they want to be pushed. And we can go back to rapport building and all of those things in those instances, but it's because it's focusing on what it is that they need. And sometimes that's exactly what they need. And so we have to be willing to do those things. And, finally, everything that we do should be guided by some strong ethical framework. We have to make sure we're operating within our skill set. And we can upskill, we can continually develop that, but our priority is our client's well-being. And so if we integrate all the skills and things that I've talked about today to maintain those professional relationships, and we're staying ethical and we're demonstrating those skills, that's when we get the positive and lasting change in our clients that we're aiming for. So thank you all for listening to me for this presentation. Hopefully it was helpful for you. Have an awesome rest of your day.
Thank you for listening to this recording in the Sports Psych Lecture Series. I hope you learned something. More importantly, I hope you learned something that you can apply in your life. Feel free to share this presentation with others who might be interested. And if you're interested in more content like this, visit the Fehr Advantage channel on YouTube, or find the Fehr Advantage podcast on Spotify, or visit my website at fehradvantage.com.